So welcome to Module 6 of the New Patients on Tap formula. We're going to be talking about all things internal marketing. So internal marketing is any marketing that you do that is aimed at your existing patient database. So it is one of the easiest, if not the easiest ways to begin your marketing journey. So essentially what you're going to be doing is you're going to be marketing at people that have already come to you as a patient, who know you, who've tried you, and so forth. It isn't about how it's different from external marketing is where we're trying to get people to come to your clinic for the first time ever. These are people who've been before and we're simply going back to them again. So you've already built a relationship with these people and they already know you, and hopefully they like you and they trust you, which means their skepticism is much reduced and they're far more likely to buy services from you again because of this relationship that you've built with them. Research will suggest, and us medics all like a bit of research, that it can cost up to 14 times more to get a new patient as it does to get an existing one to return. Because these patients that we don't have yet don't know us, so it takes more effort for us to get them to come back and see us. So we should consider using internal marketing for selling a different service to one that they originally bought. So for example, if you own a physiotherapy clinic and suddenly you want to start selling to them the fact that you also have a masseuse that works on the clinic, in your clinic. Or in my own case, if I was a podiatry clinic and suddenly I wanted to open a physiotherapy clinic or physiotherapy service, I can go back to the patients that I've already know, and I have done exactly that. You can get your patients to come back after a long break from coming to see you, i.e. reactivate them. So maybe somebody came in with a certain problem, you've resolved that problem, and you're trying to get them to come back to you again with something else, or maybe to check on the original problem they came to you with. You can use internal marketing to have your patients refer their family and their friends. Namely, this is known as word of mouth. Now, every clinic you ever speak to tells you when you ask them to do any marketing that they do word of mouth. But there's no system to it. And what we're going to show you is a system, how you can systemize your word of mouth to make it consistent and to make sure that you're not just depending on, hopefully, somebody's going to recommend you. And you can use this for generating reviews from your database quite simply and quite easily. So the options that we're going to cover for internal marketing in this module over the course of a few videos are going to be regular newsletters, i.e. what we call broadcast emails. So a broadcast email is an email that you write. It's a single standalone email that you will write and that you will send off to your leads or to your patients as a standalone email, or i.e. a broadcast. Now, a lot of people will call these newsletters. Patients are not interested in your newsletter. So if you look at a website and it says sign up to our newsletters, nobody ever does this. So that's not what we're going to be doing. We're not going to be doing it as an advertisement. We're going to be using these broadcast emails to give more free, useful information for their health upfront in advance. And we're going to also include in some of these a call to action, sometimes stronger than others. You also could use internal marketing for a patient welcome and an upsell system, and we're going to teach you that in this module. We're also going to show you how you can use this for generating referrals. So how you can systemize a referral network, get your existing database to send you more patients. How you can use it to reactivate those very same patients who perhaps haven't been to you for a while. We also will cover internal and external signage. Now, I don't mean sign outside, it's the name of your clinic. I mean actual signage that we're going to use inside and outside your clinic using the direct response and the information marketing paradigm as such. We're going to cover follow-up phone calls, how you can use follow-up phone calls, customer service for internal marketing, getting your database to come to you more often, be more compliant, and so on. We're going to also talk about direct mail, as in snail mail, as in something you put a stamp on, to other medics as a source of internal marketing. And lastly, I'm going to give you a very quick bonus email campaign that you can use for a quick win. So all you'll need to do with these bonus email campaign is swipe and deploy. Basically copy it, put it into your email provider, send it to your database of patients, and you'll start to generate new patients from that, or I should say reactivate it and new patients from that, and we'll talk about that at the very end. Now, the bonus about using internal marketing is, remember, is to do all of these things, they cost you little or nothing. At most, what we're going to be talking about here in most of these cases is the price of a stamp at most. You can be a little bit more advanced than that, and we'll go through that, but for the majority of cases, internal marketing is pretty much free to do, other than putting some time into it. So without further ado, we'll move on to the next video, where we'll get into talking about regular newsletters / broadcast emails.